The date is 13th July 2020, and we need to talk about COVID-19 testing. Our labs are seriously overwhelmed by the number of requests for COVID-19 testing. So much so that last week, some testing sites had to suspend their services. We also received communication from the labs, and I will specifically talk about the private labs at this point. We received communication regarding which patients or clients should be tested for COVID-19 as a matter of priority. Now, the labs circulated a list, and this list is standard across the labs. And they are requesting that we prioritize 5 groups for testing at the moment, so that we do not overwhelm the capacity of the lab. The problem when we stray from the request of the lab, when we start sending specimens for groups other than those that are being prioritized, the problem we will encounter is what we encountered last week, where the labs are so overwhelmed to an extent that services are suspended. But we will also have a very delayed turnaround time to getting results. Instead of getting COVID-19 results in 24 to 48 hours, we end up getting results in 3 to 5 days. And that in itself is problematic, because it defeats the purpose of trying to isolate those who are positive to reduce the risk of transmission. So let's get to which groups or which individuals are regarded as priority for COVID-19 testing at this point. The first group is healthcare workers. So if a healthcare worker needs to be tested, their specimen receives a priority. The second group is people who are in hospital when COVID-19 is part of what is suspected could be the diagnosis. When their sample or their specimen is submitted to the lab, that will be treated as a priority. The other group that is prioritized is those who are tested before admission to hospital. This group is also very important, because if someone is admitted to hospital for any other thing, it might not be COVID-19 related, it could be pregnancy related, it could be a surgical case, they might need a certain operation. All those cases need to be tested for COVID-19, so that the person can be isolated during admission if they do have COVID-19. And if they do not have COVID-19, the purpose or the aim is not to mix people who are tested positive with those who are COVID-19 negative. So that is the third group that is prioritized. The fourth group is people who have symptoms that make us suspicious of COVID-19. They do not necessarily have to be admitted, even if they are sent through for testing from their GPs, from the clinic, from wherever where they've been assessed by a healthcare professional. Those people will receive priority for COVID-19 testing. The last group that is prioritized is people who are at high risk of COVID-19 with comorbidities. So comorbidities, we are talking about people who have high blood pressure, people, for example, who are diabetic. Those people with comorbidities are prioritized for COVID-19 testing. Now, I have mentioned five groups of people: healthcare workers, people who are hospitalized, people who are about to be admitted for any other reason, even if it's not COVID-19 related. We also spoke about people who are having symptoms that make one suspicious of COVID-19, even if they are not in hospital. And lastly is the high risk groups with comorbid conditions. Now, in this list, I did not mention people who are close contacts of COVID-19 cases but do not have symptoms. And as things stand currently, a lot of requests that are coming through for testing, or people who are coming in to clinics, to doctors for testing, are mostly people who do not have any symptoms. It's people who have been in contact with a confirmed COVID-19 case. So those people, I want to deal with them directly, because these are the people who could really clog up the testing capacity in the country, because there is a lot of them. Please, if you were in contact with a COVID-19 case, but you do not have any symptoms of suspicious of COVID-19, and you are not one of the high-risk groups with comorbidities, or you are not a healthcare worker, please do not insist or submit yourself for testing at this point. Please, I will repeat, if you are a close contact but you do not have any symptoms and you are not one of the high-risk groups, please do not submit yourself for testing. What needs to happen is that you should be quarantined. If you were a close contact of a confirmed COVID-19 case, you should be quarantined, and we watch you for development of symptoms that are suspicious of COVID-19. Please do not go and test as soon as you hear that someone at work has tested positive for COVID-19 if you do not have symptoms. What happens when people go in and test immediately and they do not have symptoms? We find a lot of negative cases, because either they really do not have a COVID-19 infection, or they have tested too soon. So the recommendation is wait. Let's wait and monitor and see if the person develops symptoms. Should you develop symptoms, absolutely we will test, because then you will fall into the 5 groups that are prioritized for testing. So, in summary, let us not overwhelm the lab with testing when it is not yet a priority. There are 5 groups that are prioritized for COVID-19 testing, and if you are not one of the groups, please do not submit yourself for testing. We will test you if you develop symptoms, but if you are a close contact and you do not have any symptoms and you are not one of the priority groups, please do not submit yourself for testing. I repeat.